we are always thrilled to have Mr. Graham Champion come and speak to us. If you're fairly new to NAMI, Graham is the chairman of Public Strategies, which is a consulting firm specializing in legislative affairs, political strategy, and corporate risk management consulting that was founded in January of 2006. Graham holds a BS degree in management from Auburn University at Montgomery, and he has held many leadership positions, among them on the Executive Committee of Mississippians for Economic Progress, the Business Council of Alabama's Progress PAC, chairman of the Children First Foundation and Corporation, the National Advisory Board for the Campaign for the Mind of America, the National Board of Directors of NAMI, the Board of Directors of NAMI Alabama, the Board of Directors of the Alabama Civil Justice Reform Committee, the National Advisory Council for Fannie Mae, and he currently serves on the Board of Directors and is past president of the Montgomery Rotary Club. He's a multiple Paul Harris Fellow, member of the Paul Harris Society, and has been selected to become the Rotary District Governor nominee. In August of 2015, he was appointed by Governor Bentley as the consumer representative on the Alabama Board of Physical Therapy. He's past chairman of the Government Affairs Council of the Financial Services Roundtable and the Legislative Liaison Advisory Committee of the American Bankers Association and the BCA Government Affairs Committee. And Graham always makes sure to stay up on any current Alabama legislation and keeping NAMI advised of any legislation that might come through that would have any kind of impact on those that are affected by mental illness. So Graham, thank you so much for joining us today, and I'll turn it over to you.
Connie, thank you very much. The tribute to Rogine was very, very moving and very, very appropriate. I feel inadequate in many ways to talk about advocacy after that tribute to Rogine, but we're facing some things in the Alabama legislature that I think will be a very challenging year as we come up on it. Before the legislature comes back in January of 2022, we likely will have 2 or 3 special sessions. One to redistrict the legislature, our congressional districts, and our state school boards. And all 140 members of our legislature are up for election next year. We'll have one to appropriate the rescue money, relief money coming out of the COVID funds out of DC. And then one that I think will have a huge impact on the mental health community, and that's the construction and reform of our Department of Corrections. As I think everybody knows, one of the biggest premises in the lawsuit that the federal government has against the state of Alabama right now deals with mental health care in the prisons. And it'll be interesting to see what the legislature does as they move forward with their prison plans. I expect that special session will probably come sometime in September or early October. Last year, we had a piece of legislation that was passed by a freshman legislator from Montgomery, Tashina Morris. She introduced the legislation originally in 2020. It did not get out of committee in 2020, but her persistence led her to reintroduce the legislation again in 2021. And it's legislation that passed, the governor signed, and it will require mental health awareness to be included in the annual training session for teachers as they go back to school each year. The fact that the legislature has finally realized and acknowledged that we need to have mental health awareness in the schools, and that the teachers need some training on that, I think is huge. We've got several legislative heroes. We recognized 2 last year in House Majority Leader Nathaniel Ledbetter and Representative Rex Reynolds from Huntsville for their leadership in the mental health arena. I think that you're going to see Representative Reynolds continue to push until we get the CIT legislation passed that will require CIT to be taught in the Alabama law enforcement training programs. There's one piece of legislation that has been introduced or pre-filed for the 2022 session. It's a piece of legislation that is coming back for the 3rd year. There are a number of groups that have been successful in killing this legislation to this point. With it being an election year, I don't know that we're going to be successful in killing it again. But it's Senate Bill 5 by Senator Shay Shelnut from the Birmingham area. This legislation is aimed at prohibiting any treatment of any type for adolescents with gender dysphoria. It would criminalize the practice of medicine. It would criminalize the practice of pharmacy. If a physician prescribes certain medications that are evidence-based and a pharmacist fills it, they would be guilty of a felony. It criminalizes the practice of counseling. And I want to read to you just briefly. No nurse, counselor, teacher, principal, or other administrative officials at a public or private school attended by a minor shall do either of the following: encourage or coerce a minor to withhold from the minor's parents or legal guardians the fact that the minor's perception of his or her gender or sex is inconsistent with the minor's sex, or for the counselor or teacher withhold from a minor's parent or legal guardian information related to a minor's perception that his or her gender or sex is inconsistent with his or her sex. This would be a direct violation of the confidentiality that exists between counselors and those being counseled. I know typically NAMI and a lot of other groups would not get involved in what is referred, I guess, to by legislators as transgender issues. But when you start seeing legislators purely for political reasons trying to dictate medical practice, and I include counseling in medical practice, then it's a serious issue, and one that we need to look at, that the advocacy committee needs to look at before we get to January and decide what position NAMI wants to take. If we can't protect those that need it the most, then I don't think we're doing what Rogine would have asked us to do, or what she would have done on her own. With it being an election year, I think we're going to see a lot of issues that will pander to voters. One thing that I am seeing is that I believe the Department of Mental Health is asking for money for 3 new diversion facilities for substance use disorder, which would be great. I think we're going to see issues dealing with the substance use disorder in pregnant women. There's a case in Northwest Alabama right now where a mother is being prosecuted for having taken opioid painkillers while she was pregnant. Now, she was taking them on a prescription from her physician. She was taking them in accordance with the prescription. She was not abusing them or overdosing herself. Yet a zealous district attorney has deemed that it was child abuse. And I think we're going to see more legislation aimed at trying to punish anyone who takes a prescription medication that could be considered an opioid or a drug that, when abused, could be a problem. So I think we're going to have a very, very busy year as we get into the legislative session. With it being the 4th year of their term, they come in the 2nd week of January, and they'll be gone by the middle of April. So Connie, with that, I'm more than happy to take any questions that the group might have. I'm always open to suggestions or comments or always help as we get into this process.
Graham, okay, hold on just a minute. We have a comment that we need more treatment, not more criminalization of substance use disorders, which I think we can all agree on that.
Absolutely.
Yeah. And so the legislation that was put out by Tashina Morris, that's passed and that will go into effect. It is in effect.
It is in effect. Yes, ma'am. The governor signed it, and I suspect a lot of that training occurred this year as they were going back to school.
Right, and that's, you know, such great news, because so important for us to have that early knowledge and be able to intervene early. Dennis Shannon from NAMI East Alabama says he's working with the Treatment Advocacy Center to change the legislation on the involuntary commitment. And I asking if you might be able to advise on getting sponsorships in the legislature. We're looking for a sponsor for the bill.
Okay, that draft legislation was sent to me several months ago. They said that y'all were still working on it, so I have not seen a final version of it.
Yeah, I don't know that there is a final version, but Dennis can you tell us in the chat, Dennis, if we have a final version yet?
And if so, if somebody could send it to me, I'll look at it and we'll see if we can find somebody to sponsor it.
Okay, all right, because we were asking at yesterday's meeting if anybody knew of a legislator that might be, you know, a potential sponsor. And there were some suggestions, but Dennis is saying no, they need to talk to Brian Stetton before. Brian's been, and his staff at the Treatment Advocacy Center have been working on the bill.
Okay.
So
if y'all could get Brian in touch with me,
yes,
to let me, you know, walk through with him, you know, some of the construction issues that we need to look at as they're putting that draft legislation together, I would appreciate it.
All right, we will definitely get your contact information with Brian.
Hi, Graham, this is Ida. Can you send a brief synopsis of the things that we should be worried about? I was trying to write everything down, but I'm not that quick.
Yes, ma'am. I'll get something out first of the week.
All right, thank you, appreciate it.
Yes, ma'am.
Okay. Well, I don't.
Graham, this is Judge Frank Barger in Madison County. Representative Reynolds is a part of our legislative delegation. We actually already have a call scheduled with him and Brian Stetton from the Treatment Advocacy Center, along with Jeremy Blair from our local Department of Mental Health provider, to just discuss the legislation that Brian is putting forward. I certainly know that Representative Reynolds has an interest in what the Treatment Advocacy Center wants to see happen in the state.
Judge, that'd be great. And Rex is one of the bright stars in the legislature. and is truly a mental health hero in terms of support of issues that we have an interest in. So, if in your conversation, if you want to say, ask him if he would consider sponsoring the legislation, and tell him I'll be glad to work with him as we move forward. That'd be
Well,
great.
I fully intend to ask him to sponsor it. Rex has been a champion for what has occurred here in the county in conjunction with the city of Huntsville, and is working to implement the model CIT program that's been created here around the state, making it a requirement. Now, I know you already referenced that, and I'll certainly reference that he might want to engage you as he moves forward. But I'm excited about the possibility of course, I can't put words in his mouth, but I hope that he picks this up and runs with it.
I suspect he will. I think the only thing that might dampen that enthusiasm is if Representative Ledbetter, who is a majority leader and who has already announced he's running for Speaker of the House, decides he wants to handle it instead of Rex.
Well, I don't think that would be an issue.
I think personally, I'd rather have Rex handle it.
Well,
he does a good job.
I think that Rex and Mr. Ledbetter have a good working relationship. I don't think that would be an issue. I think they want to see it done.
There's no doubt in my mind they want to see it done, but sometimes there's it's my victory, not yours mentality.
Sure. Well, I'm not going to get into that, but it's been my experience that with those two, it's not overly territorial. The short of it is Rex is aware of this piece of possible proposed legislation from the Treatment Advocacy Center, which I am a fan of, and I am connecting him with Brian Stetton. I just wanted to make sure that Connie and the board were aware of that.
That's great. Thank you, Judge.
Yeah, thank you, Frank. We appreciate you so much. Yeah, there were 4 NAMI Alabama advocates that just returned the other night from the national CIT meeting that was held out in Arizona. So that's great news. And as far as the legislation that was put forth by Tashina Morris, the NAMI Ending the Silence program is geared for schools, and we're excited that they're getting this training for the teachers and the staff in the schools. And we also want to educate the students and the parents. Everyone needs to know, what are some early warning signs to look for? How can you help? So we all need to work together, and we're sure excited that there's some keen interest in getting into the schools about mental health education. Awesome news. So thank you. I don't think we have any more questions for you, but Graham, as always, we always appreciate your presentation. It's always so informative, and keep us on track and keep us in the loop. If there's anything we need to be doing, please let us know. We're on it.
Thank you, ma'am.
We're going to stand up on Rogene's shoulders and do it. Get this done.
Well, as I said, it was hard to follow that tribute to her, but
Yeah,
I guess it was appropriate to have the advocacy report right after that. So
indeed.
thank you all for letting me be a part of it. Thank you for letting me represent NAMI. It's an honor and a privilege.